Today we're focused on emergency response and disaster preparedness, a critical area for the NCLEX, where you must know specific protocols and your exact role. The exam will test your ability to act decisively and correctly, whether it's an internal facility fire or a mass casualty incident. Let's start with an internal emergency like a fire. The NCLEX loves to ask about the first action a nurse should take. They'll give you a scenario where you see smoke coming from a patient's room. Your options might be to pull the fire alarm, grab the extinguisher, or get the patient out. The correct answer is always based on the RACE acronym. RACE stands for Rescue, Alarm, Confine, and Extinguish. Therefore, your absolute first priority is to rescue anyone in immediate danger. Get the patient out of that room. Only after ensuring patient safety do you move to pulling the alarm and confining the fire by closing doors. Remember, RACE is the sequence of actions. Don't confuse it with PASS, which is how to use an extinguisher. Pull, aim, squeeze, and sweep. An exam question might try to trick you by offering an action from PASS as the initial response to a fire, but your first thought must always be RACE. Now let's shift to external disasters and mass casualty incidents, which require a different mindset. In the hospital, you're used to treating the sickest person first. In a disaster, the goal changes to doing the greatest good for the greatest number of people. This is accomplished through triage, and for the NCLEX, you need to know the START system, which stands for Simple Triage and Rapid Treatment. Imagine you arrive at a scene of a tour bus crash. You have multiple victims. Who do you help first? You use triage tags, red for immediate, yellow for delayed, green for minor, and black for expectant or deceased. The exam will present you with 4 patients and ask who is the priority. For example, a patient with a massive head injury and no spontaneous respirations, versus a patient with an open fracture and controlled bleeding, versus a patient with a sucking chest wound. The patient with the sucking chest wound is a red tag, immediate. The patient with the fracture is likely a yellow tag, delayed. The patient with the devastating head injury, who is unlikely to survive even with immediate care, is a black tag. This is where it gets tough. You do not prioritize the black-tagged patient. You provide comfort care only after all others are treated. To make these decisions quickly, use the mental shortcut 32 can do. This helps you assess the 3 key areas of the START system. First, check respirations. Are they over 30 per minute? If yes, they are an immediate red tag. If they are not breathing, reposition their airway. If they still don't breathe, they are a black tag. Second, check perfusion by looking at capillary refill. Is it longer than 2 seconds? If yes, they are a red tag. Third, check mental status. Can they follow simple commands? If they can't do it, they are a red tag. If a patient passes the 32 can-do test, meaning their respirations are under 30, cap refill is under 2 seconds, and they can follow commands, they are likely a yellow or green tag. This systematic approach is exactly what the NCLEX is testing: your ability to apply a standard protocol under pressure to maximize survival in a disaster. Remember, in a disaster, the rules change from individual care to population care.